I have been struggling with 3 dying teeth in my mouth, 2 of which have since been removed. So I take it we got 1 left. I would like to stop this poisoning that is supposed to be 30 times worse than mustard gas. Oh my God. Holy crap, what is that neurotoxin? Damn straight. What is that? This has had a powerful negative effect on my thyroid. Oh, I bet. Oh, I bet. I have had such a reduced immune system that I have had colds and flus every week for over 2 years with headaches and sinus. Oh, shit. Well, you know, gee, look how this is tied in. Now, think for a minute. What's the tie-in to the sinus, the headaches, and the teeth? What's the tie there? Your lymph system, man. This is your lymph system. And you're backed up real big. So, this starts pressure, starts chewing on your gums, and then we have a few fruit and blame the fruit. Now, this is a big deal to you. You want to detox the head area, meaning this is also sitting on top of your GI tract. So you might want to get in and get the kidneys filtering, get your adrenals up, get that lymph moving, get your sinus drained, get the bowels cleaned up, and get this lymph and this acid out of your head, because it's chewing on more than your teeth. And it wasn't your immune system was so much down, it's what you got in you. See, you can't get a cold or flu if you're clean. You couldn't if you tried. I don't care. Cleanliness is the next to godliness, right? Meaning that if you have a clean sewer system, there's nothing else, there's no seat. You remember, it's the terrain or culturing medium that deals with virals and bacteriums and things like that. Not so much fungus fermentation, more bacterium. But then, if you're not digesting your foods properly, you're absorbing you're going to have fungus. And even in the body where carbon is, you could have fungus. You know that? I would like to have a direct application to stop and reverse these dying teeth. You can't stop them until you move the lymph. Till you get your gums cleaned up with lymph. You can use your Heal-All tea in your mouth. Hold it in your mouth, now to clean your gums and draw and pull. So while you're watching TV, make yourself some tea and hold it in your mouth. Things like that. But you got to get inside and detox it. And that means get your kidneys filtering. Make sure you're filtering. Means you got to get your adrenals up. That'll turn on the kidneys. You'll start fixing and cleaning everything. Your teeth will come clean if you can save them this late. And get that done. If you have good genes, possible to rebuild some teeth here. But you want to get onto that. Make sure the parathyroid up. That's obvious. You guys really get it. I love you guys. But why do these glands go down? Lymph, lymph, lymph. This is the way we go to Lymphville. And nobody wants to go to Lymphville because Lymphville's Hellville. Just with another name. But get your lymph moving, get your body filtering, my friend. You've got to do that and get this all clean. You need to get your sinuses cleaned up because your body's telling you, I'm full, I got to drain. No mucus, no drain. And when I was on all fruit and oranges, I never lost any teeth. I know, Juby, you talk about sweet fruit in your teeth. But I can just tell you, sugar's alkaline, not acidic. Acid is what destroy the teeth, not sugar. And we have to define sugar. This morning on Fox News, they're talking about sugar or fructose syrup. Or high fructose syrup is addicting, like he said, marijuana and cocaine, the pressure center in the brain, this bullshit like that. And of course, sugar, that's the problem. It's the main need of the human body, but a simple sugar. So we just throw these words out here without any qualifications, so it gives wrong opinions and wrong assumptions by the populace. So now sugar's bad. And now some of you guys picked up on that, sugar's bad. And it's like, what? You know what I'm saying? You have to read through the lines, and people don't qualify themselves, particularly medical doctors, because they don't know. They're just echoing research and echoing others and echoing what they see. They don't have experience. They don't have knowledge in those fields. And these news agencies pull in these medical doctors to be their analysts and medical analysts and stuff, and they're all, no offense, but you guys aren't real bright when it comes to health and wellness, and yet you're giving opinions out there that really hold no water or substance, and yet the people are listening and buying into that. You have to understand that you're losing your teeth because of lymph, not because of sweet fruit, especially sweet fruit. You lose your teeth more on acid fruit because it makes you an acid saliva. Sugar's alkaline. It alkalizes, and you don't lose your teeth in an alkaline medium. You lose your teeth in an acidic medium. You must look deeper within that, because what's your teeth made out of? Cells and fluids, like everything else. You have some matrix in there. It's a little different, just like bone. You have a little matrix of phosphorus and calcium. It locks everything right in. What do you do about dental disease? Everyone seems to have it, and there are a lot of people claiming fruit is bad for your teeth. Yeah, yada, yada. Yeah, again, it's not the fruit, it's the acidosis. It's not the bacteria, it's not the fruit, it's acidosis. So if you're eating an unripe pineapple, you could create a leaching effect on the teeth, no question, because it's highly acidic in an unripe stage. So again, we're going back to the importance of eating all your fruit ripe. That's essential. And getting pH peppers and checking your saliva, because most people have an acid saliva because their lymph system is backed up all through. You can tell with the swollen lymph nodes, those without tonsils, those that have acidosis. In the body, any place has it all through you. And it's just that nowadays the lymph is so backed up in people's head. The teeth are gone, TMJ's hot on the market. I mean, all these deterioration of jaw bones, etc., etc., etc. Let me tell you, we had a case once, and he had a cancer down here under his jaw, and they cut out this part of most of this jawbone and this tumor. Well, he came to us, I don't know how long after that surgery came to us, and the cancer was back. And so, and we saw the x-rays where there was little jawbone left and all this. Well, he tore into a high fruit, berry, and melon diet. And in 6 months to a year, I can't remember the time frame there, we had another x-ray, and this jawbone had grown completely back. And that was on a fruit, berry, and melon diet, guys. And so we went in here and cleaned him all out and got his lymph filtering. Because remember, when you treat this symptom, you never find remedy because you never address the cause. And the cause is always there. And it will always be there chewing on you until you go after that cause. And the cause is always on the acid side of chemistry, at least most of the time, and always in the lymph fluids. And so by changing the way we treat the blood, and by the diet change, we can reach through there and get into the lymphatic system. And then with the herbs, we got tissue-specific herbs for the kidneys, for the lymph, for these things to help us. And then there's not much else. Not much else on this rock. Also, you can wash your mouth out with a heel-all tea. Don't make it too strong because it's real astringent. Hold it in your mouth and start cleaning the gums out and promoting more blood flow in the gums. At the same time, get your saliva alkaline, and that'll start the rebuilding process. A key to do that. But I have a hard time believing that's something that makes the rest of me feel so good. Exactly. It's just, and we were talking about that earlier too, believe it or not. And it's just the condition man wakes up to when he looks at his mouth, and then he goes on fruits and blames all this on the fruits. There's no question that unripe fruit is too acidic. We had a young man in here earlier where when he ate pineapple that's unripe, then he got bleeding of the gums. That's how acidic, but it's also how thin his capillaries are. And you're going back to the connective tissue, you're going back to the parathyroid again, blah, 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 in that respect. But you want to keep alkaline saliva. It is a somewhat look interstitially. So when your mouth is acidic, interstitially, all the fluid around the cells, the lymph fluids, is acidic, and you're going to break down teeth, you're going to have gums receding, you're going to have all these problems. So people just blame it. And I think the one reason is we have a bad case of unripe fruit here in the States and in some countries. So grapes are better at that. Sometimes you have to stay away from the citruses, the kiwis, the pineapples. You want to make sure these are ripe on the tree. That's all I can say. Unless you pick a pineapple off a plant ripe, you're getting an acid food. This is the problem that makes it so discouraging, is that even the citruses are so good when they're picked ripe. This idea of picking unripe fruit has got to stop. I don't care if we have to truck every day. So what? We're becoming hunter-gatherers again just to seek good food. It's a shame. It's just discouraging every time I go to the grocery store. I have tested my saliva, and the pH is acidic. Voila. Just what I'm saying. Just what I'm saying. I imagine this is a big part of my problem. Hit it right on, Chad. Love you, man. Telling you, hit it right on. And that's the point. This is the saliva. This is your interstitial fluids. Get that alkaline, and you will save your mouth. And if you test it, get pH papers, if you guys don't have them, and even check the grapes, and look at the difference between eating green grapes, eating red grapes, and eating black grapes. Look at the differences in pHs and stuff. But remember, you're going to have saliva and invoking digestive enzymes, which is base. But check your saliva when you're not eating anything. See what's going on. Get up in the morning and check your pH of your saliva. If it's acid, to the teeth, to the gums, to the jaw bones. This one person asked me about teeth cavities and remineralization. Decay is acidity. It is. And you know what? The Minnesota School of Dentistry is starting to realize it isn't the sugars, it's the acids. You know, and of course what these things, it isn't the bacteria. You know, people are freaked out, even dentists, about bacteria. Well, I have news for you. Bacteria are only hungry little people. You know, but it is about the acids. So the Minnesota School of Dentistry has sent me some stuff on acids, like Gatorade having a pH at 2.85. I think Gatorade ought to be fined for that or something. I mean, of course, I'm a freedom guy, so I don't know. But misinformation like that, willful misinformation is not good. To me, it's a borderline criminal there, especially when people are taking Gatorade to rehydrate, and it has a pH of 2.85. There's no rehydration to it. I heard the National Football League got wind of that and a little upset. I don't know that to be factual. But that's acidic, and I always wondered why I tasted it one time, and I always felt acid in my stomach, and I thought, well, this isn't alkalizing, and I was right. You know, intuitively, when you follow that, you really do better. But that was out of the Minnesota School of Dentistry, so Gatorade, see, you might want to, if you disagree, you might want to prove it. Yeah. He's on a complete fruit diet. After breaking my fast, I came on a complete, well, you're kicking butt, Sam. And it has been 6 weeks, but in all this period, my teeth have been extremely sensitive. Well, use your bicarbonate. Use your baking soda, aluminum-free, and wash your mouth out. Get you some pH strips and make sure your mouth is maintaining alkalinity. Because you can be very acidic in here, and then sometimes the acids on the fruits can you know, irritate that even more. Make sure your saliva and mouth is alkaline. And if it's not, use a little baking soda, wash your mouth out, hold it in, let it absorb a little bit, and keep doing that and pull that soreness out of there. Extremely sensitive, and certain parts of my front two teeth are less white than other parts, such that you could almost see right through. Wow. So what I would do, I would look at my parathyroid gland. You might want to add a green drink in there just to put some more chemistry in the body, more minerals there to bring things up. But I'd take a good look at my parathyroid. Your mouth sounds like it's way too acidic, so you're losing calcium out of the teeth and stuff. So you want to make sure that you're utilizing calcium out of your foods, number one. Make sure your mouth saliva stays base or alkaline, even if you're eating oranges or something like that. Even if though the chemistry ends up base, you still want to keep that base in the mouth. Put yourself on a long extended red grape fast, and it'll make that mouth very alkaline, and then all that calcium will come back in and heal up again. Now I have an abscess in my gums for my entire detox. Get this one. It's in between my front and second on the right side. That is the site of an accident when I was a child. Look at that. And you know, this is what we're talking about. Even what Jensen was talking about, these genetically weak areas, these damaged areas, if your lymph system isn't moving, that damage doesn't heal. I was just talking to a fellow out here with that. And we were talking about how these things don't heal. Matter of fact, his wife came in. She's out there having seizures. She was hit when she was a young child, and she let me feel her head, and there's the skull had been smashed in. So she's having all kinds of problems. And so when you see that, you know immediately that the system that's designed to clean you, that's not the blood, the system that's designed to clean you, and clean the blood, by the way, is the great lymphatic system. You're not filtering well. And so all that trauma can't be cleaned away. If it was blood, it'd be long cleaned and gone, because blood moves around the body generally without much problem in less than a minute. So your blood's moving well. It's not blood that's the problem, as we know that. It's the lymphatic system. And this is a good case, Karen, to show you this. Interesting enough, it's a site of an accident that she had where she flipped over the handlebars of my bike and hit a street sign pole, oh God, right in the mouth, knocking out my teeth. Anyway, I'm thinking that my head is using this weakness to drain the lymph system from my head. That's fine and all, but, well, maybe. I don't know if that's true, honey. I think that's a pocket of lymph, pocket of pus, right? And that's just not going anywhere. It's not moving. And it's possible you're having if your tonsils are out, that ought to be interesting, or adenoids. See, we don't know what cells the adenoids and tonsils feed into, or what cells feed into those 4 lymph nodes. We don't know that. And this could be a case, I don't know, I'm just putting it out there. It's enough to say, though, you're not draining that jaw because that abscess would be drained out. Heal all T, all right? While you're watching TV, hold it in your mouth. Use the cooked herbs and make a poultice on top of that. And let it draw that out. You could use any drawing salve, really, but I think the Heal All Tea is going to be adequate enough. And hold that, because this is how we get abscesses out of the mouth. And put that raw herb there, that cooked herb, right up in that, on top of that, and let that do some pulling and drawing. But the acid keeps oozing through this place and breaking down my gums and bone. And she's right on with that. That's interstitial. That's the lymph system. And we talk about foods. It's really the lymph system that breaks our teeth and jaw and gums down. Receding gums, that isn't fruit. But with that said, remember the acid fruits and unripe and stuff. Yeah, if your mouth is acidic, you're going to lose calcium out of your teeth. You're going to lose because the body doesn't like to be in a state of acidosis, no matter where we are. How do you maintain your teeth and not get canker sores in the mouth from the citrus? I always thought that the citrus hurt the enamel of the teeth. Well, first of all, if fruits are allowed to mature on the trees and pick ripe, you wouldn't have that problem. The problem we're having with the citrus is it picked very unripe, and so it's a little more acidic than it would be. That's number one. Number two, if you have that much herpes in the mouth, I would definitely get rid of the citrus. I'd get off the acid fruits, go to the subacid where you're having more grapes and apples, and your sweet fruit. You're still probably going to pull some of these, but that just shows you're full of herpes in the mouth, and you've got to. That's all acid. It shows how acidic you are in the mouth here, dear. So you've got to move your lymph, get your GI tract cleaned out, and get your kidneys filtering and start moving your lymph up in here and clean all this out. I found a website, www.cancertutor.com, that had 2 articles linking cancer to the teeth, identified through the use of thermography. Well, let me back up from there. Cancer isn't caused by bad teeth. Although the same reason that causes cancer causes bad teeth. Get the difference? See what I'm saying? They're trying to get you to think that they're trying to blame you or your body for the problem instead of your hand-to-mouth thing, and your lifestyle and your genetics and what's going on inside of you and the acidosis and stuff like that. So you see how they correlate? And so you're going to see sites like that blaming things. But the reality is you have bad teeth because of the same reason you have the cancer. It's the same system. It's the same acidosis. So it's the same system that you got to deal with. Not that your teeth cause that at all. You don't have to worry about that. But you have to worry that this system that you have down, Gene, is systemic. It runs through your brain. It runs through your heart and your lungs. It runs through your testicles and your feet. So this same system is everywhere through you. And that's why you see multiple problems popping its little head up. Some of you having a hard time with the fruits. Of course, very few of you are seeing the teeth, you know, and how acidic one is with this. So there's a big change with that. A lot of you are in chronic pain. Sometimes fruit can make that pain worse, so you might have to step down just a little bit and go through some initial stages. Pick the fruit that doesn't cause so much pain with you. You know, because when you start detoxing, some people really start feeling the movement of acids and really start feeling even the acids in the fruit that actually break down all into alkalis, basically, still. When you're eating fruit, it should leave an alkaline saliva in the mouth. It's not good to leave an acid saliva in the mouth, so fruit should bring forth an acid saliva. Some of you are so acidic that the saliva is acidic. And that's where you see your tooth decay. One I'm going to address here with all the problems in the head and everything. Actually, when you start detoxifying, your weaknesses are exposed. Remember that? And that includes teeth. I think I gave you a case where it was a pancreatic cancer case that along the journey, one of her teeth became loose, and she had it pulled at a dentist, and there was another that was loose, and she was going to have that pulled. But in between those two, she came to see me for her appointment, and I told her, I said, "Oh no, that's detox." Well, by the end of that week, all her teeth were loose, and her gums were receded, and abscesses. She had, if I remember right, 7 abscesses in her mouth altogether. And as I had her gargling and holding the heel-all tea in her mouth, I had her on the high fruit, I had her on the herbs, and in 2 weeks, those gums were locked right back on those teeth, and everything was clean and green. You might see the body trying to get rid of weaknesses, and this is the problem when it comes to teeth. We like teeth. The problem is they're like any other tissue in the body. They're lymphatically broken down, and thank God some of the dental schools are starting to think acid and lymphatics instead of bacteria. I hate that. They get to the reality of these things. So that's what you're seeing. You're seeing what already exists. You're not seeing the fruits create this. You're seeing what already exists. So it is true, though, that, and you check your saliva, most people's saliva is acidic because of the acid diets. Well, that chews your enamel off right there. It isn't the alkaline grapes. They don't have the acids that are strong enough. You could argue that with too many acid fruits when you're already weak in the teeth, you might see some stripping there. I don't know. I never had a bit of that on my oranges for 6 months, and I've just never had that with any of my diets. And most of the people I hang with, their teeth regrow. So I don't know what to say other than if you want to slow down, then go to the vegetables first. Detox as far as it'll take you. Get up on that parathyroid. Try to get up your bowels cleaned up so you can drain all of this. You got to get the throat lump gone anyway. Excuse me. And then really then take that next step into all fruit. It's not wise sometimes. I'm taking you guys to the top of the mountain because we have so many serious cases. At the same time, though, it'd be wise. Some people, you got to slow up and let them go some vegetable route first, and they'll reach a plateau. You'll see it every time. Then you can kick them up to another notch. So you just kind of watch that. That's why I said detoxification is an art. And it's an art to know when to hold them and when to fold them. It's an art to move someone through the straits and the pitfalls that this brings because of their weaknesses in genetics, not because of the program, because of their weaknesses in genetics and the lymphatic system. So again, this is a process where you move yourself, and you'll see it in yourselves. Sometimes you got to back up a little bit. Know if fillings are toxic. Oh, this is a question about you were going to have some fillings put in. Well, You know, my dentist pushes composite because they're white, enamel type, and there's gold. So you got those two. Now someone mentioned there's another one out there. So I don't know, you know. We have the worst dentistry, I think, in the world, or one of the worst. Probably not the worst in the world, but certainly most of our clients that have money go out of country for their dental work. Believe it or not, Africa, there's a certain place that's just top notch, but also Costa Rica is well known, very cheap and extremely good. I met a dentist in Portugal that laughed at the dental work that America does. Just thought it was terrible. You know, use a composite or gold, in my opinion. You definitely don't want to put amalgams back, and they're still doing it. I'll say this: if you do too much holistic dentistry, they'll pull all your teeth out. Get rid of your amalgams, get rid of your metals. I can't believe, this is when I do believe that dentists should be sued, is when they're using mercury again. You don't put mercury, it's a neurotoxin. We know mercury is a bad neurotoxin. So you don't do it, you know. Use a composite or use gold or something if you have to. What's your take on root canals? I have two, no problems with them, but need another one done under a crown. Cavity under. Better to pull teeth, what to put in place of a tooth. I'm going to say this to you. As a man that has a love-hate syndrome with dentists, I would say that I would have a root canal before I would lose my tooth, but I would have calcium put in the root canal. What the problem was is that dentists in America were using this substance that kills cells. And they were doing that to keep infections away, but the problem, it killed the tooth and create more infections. And so it's all about the packing substance. It's all about the packing substance. And that just needs to be a calcium citrate or some type of calcium that has a base chemistry effect and basically just locks it in. You still are feeding. You know, everything's a cell in the mouth, and the teeth are the cells of the human body. When you go pulling teeth, then you got to replace them. And that's not fun either. You're either going to put a rod in there and have a implant. You know, it just gets into things, and it's nice to have teeth. That's all I can tell you. When you ask older people that don't have any teeth, we have a lot of older people that can't chew salads. You know, believe me, when you lose the teeth, you can't chew. It becomes somewhat of some compromise there, so you have to handle that. I would not have my teeth pulled. I've had many root canals, and we use a calcium substance. But need another one under a crown. Well, if you're going to use crowns, you're going to use things that are not metals. You don't want any metal crowns. You want metals out of the mouth. So do composites, porcelain types, and stuff like that. I know in a holistic dentistry, they'd assume pull all the teeth out and all that. I'm telling you, it's nice to have teeth. When you don't have teeth, then chewing is a big problem. So you think lettuce is tough now, try chewing lettuce without teeth. Not good. My question is about root canals. I had one done 7 years ago. Recently it started bothering me. I just learned that they are extremely toxic as the dead tooth has small canals. Yeah, I mean, and they were using this toxic substance that kills cells even more. So yeah, that's why, you know, where in Europe where they tend to use more of a calcium substrate than we were in this country using toxemia. I mean, but yeah, you know, I don't know if you want to just pull it to go into an implant in that. Depends how important that tooth is to you. Do a bridge if you don't want to do an implant. You know, do something like that. You know, but that's all decay from acids, and that's why we end up with a root canal in the first place. I should speak. You know, I lived all my life in dentist chairs. You know, I was raised on milk. Always had sinus. Always couldn't breathe. Earaches. No one told me what was wrong. I had one medical doctor say one stupid thing after another. And then when I learned, I'm going, oh my God, that was simple. I just quit drinking the milk and clean out all the congestion. Too simple. Should I get it removed out of my head? Probably. And then either bridge if it's an important tooth. If not, don't worry about it. You know, it would be better if you have a tooth in a place where you don't use it a lot, then don't implant it. I wouldn't do anything with it. Just pull it and let the gum and the bone heal. If you want to implant it or bond it to another tooth. That's the only way you can do it. But it does talk about the lymph system, you know, same problem. Most of us can feel these lymph nodes under here at any given time. When you're up in the head, this is the most difficult, you know, to get in and regenerate teeth. But you can regenerate your teeth like you can bone. A fruitarian with a friend of mine, he was regenerating his enamel in the first year as a fruitarian. Now Yaz, who's one of the YouTubers and one of our clients, he's over in Indonesia. I mean, Yaz, you know, from what I hear, and I'm anxious to hear where you are now, but he's starting to get at that level of regeneration of the teeth. That's a deep level, let me tell you. And your lymph has got to be moving up out of the head area. How do you regrow your enamel on your teeth? You really move your lymph, you know, and get your saliva and get your mouth alkaline. And that's moving lymph, fix up your GI tract, make sure your parathyroid is really up there so you're utilizing calcium. But you've got to move lymph in your gums and mouth. You could use some Hilal tea and use it as a mouthwash or gargle, or hold it in your mouth and clean your gums even faster, but you really have to move lymph. Thank God dentists are starting to learn that it isn't bacteria that's the problem, it's acids that's the problem. So now you're seeing these new dentists understanding that these infections and stuff in the mouth is highly acidic, and they interject it with alkaline material. They're starting to learn that acid-base connection. And so you're seeing this getting momentum now. And I was mentioning the Minnesota School of Dentistry, which I assume, I don't know much about that, but I assume it's a fine school. Obviously, they're looking at acids, so I respect that a great deal. Do you have to brush our teeth with that toxic crap? You know, use any type of sodium bicarbonate or something like that. It'll be fine for the teeth. Can you explain why we have involved canine flesh-tearing teeth? I love this one. Paul, please, my God, if you're going to insult me, do it right. I mean, come on, man. Why do we have canine-tearing, rip-tearing canines? If we are so disposed to fruit as you claim. Well, you don't have to claim, think it out, Paul. Use your brain and your awareness, Paul, and you'll see. Now, let me show you something. This is human canine. Some people have a little bit bigger canine there, no question. Depends how far back you were in the doggy life. That's a human canine right there. That's a dog canine, Paul. That's a dog canine. That's for ripping flesh. Not this. Don't insult our intelligence, please. Please. Are flesh-ripping canines. Now, you might be right about one thing. There are some primates that have some pretty good canines for opening up fruit and nuts. You wouldn't want a canine to be a primate to be violent against humans, because you see what happens. And also that the group of chimpanzees now that are actually now cannibals, way out of character, way out of that, and you see the mutations of that. So thanks, Paul. Appreciate it. Got it stuff. Listen, man, I'm giving you this free. You're probably going to have to hear some of my ranting and raves, you know. Sorry about that. Try to definitely pull that in, but you can tell that I've been through a lot with corruption and stuff, and part of why I'm here is truth, not just health. Health is a little bitty thing. There's so much more to life. You should be eating your health and not even thinking about health. Health is health. You got to work for it, you get it, and you go on. But thanks for your communicate, Paul. But I had to laugh when you said canines. People bring that up. There's canines, folks. Those canines will rip the flesh off. These won't. I have to laugh here. Sorry about that.